We are here today because of the mismanagement of the health sector. And I have been following the news, and it appears as if Dr. Tufton thinks that he's above criticism and he's above being held accountable for what has happened in his ministry. But I want to ask every Jamaican out there, if you have a minister of government and you have about 10 facilities that a pregnant woman can deliver a baby, in one of the facilities, you have a bacterial infection that is resistant to most of the antibiotics that you have. The minister does not tell you. You go to that hospital to deliver your baby. You become infected, your baby become infected, and the baby dies. It is not in other hospitals. So if you had gone to another hospital, you wouldn't have been infected and your baby would not have been infected. Tell me if that minister has not run afoul of the governance process, and he is culpable. And I don't even think that we should be having a discussion about whether or not he should remain. Tufton should be decent enough to leave the Ministry of Health, knowing what he did. And his argument, he has said some things, two things. One, he has said that it is because of a shortage of nurses that has caused the problem. If that caused the problem, how is it that he's telling us that the problem is fixed and he hasn't employed one new nurse? There's a shortage of nurses caused the problem, you know, and you have fixed the problem without employing one new nurse. That doesn't make sense. He said he didn't tell the country because he didn't want panic and hysteria. But he also didn't tell the cabinet and he didn't tell the Prime Minister. Is he saying that the Prime Minister would have panicked and there would have been hysteria in the cabinet? That does not make any sense. He's not talking to idiots, right? So Minister Tufton needs to understand that he is not the authority on matters relating to healthcare. To be frank, Minister Tufton can't even pronounce most of the jargon in the health industry. Can't even produce most of the jargon in the health industry. Every time you ask him questions, remember I'm not a doctor. That's his default setting. Remember I'm not a doctor. I have to check and come back to you. So he's no authority on health. Why does he operate as if he's above criticism and nobody can talk to him? He's on a platform in Clarendon saying that mouth make for chat. But that's exactly what we're asking him, that he should have used his mouth to chat and tell the country that there is an infection in the hospital. And if he had done that, people would have gone to a different facility. No labourite, no sympathizer in the media can overlook the fact that if you told the public that persons could have gone to a different hospital, they would not have been infected and their child would not have been infected. Lock down this country if needs be, right? Because this government, should they have a majority of 49 in the parliament, they are behaving as if they are above everything. Nobody can talk to them. Nobody can say anything. Well, we are telling them that that is not so. They are a government with a minority. They only got 21% of the votes. And so we are holding them to account. We are speaking up for those people in the society who can't speak for themselves. I am saying to you that what the minister has done is a dereliction of duty. He had a duty of care to the people of this country. And because he did not say anything, he did not do anything during that period, it means that persons went to that hospital and they became infected, the babies became infected, and those babies, some of those babies died. Some of those people would have gone to a different facility if he had said so. You can't overlook that, you know. If he had said to the public of Jamaica that there is a bacteria at Jubilee that is resistant to antibiotics, a pregnant woman would have gone to the University of the West Indies or any other facility, a private hospital, and she would have had her baby and the baby would still be alive. He cannot escape that. Their voice is in concern against the injustice that is taking place in this country. This is a government that is failing, and they're trying to use PR to hold them up, but it is really a government that is failing. We have a Prime Minister that goes and demolishes the houses of poor people. We have the wife of the Prime Minister that comes now to denigrate the same people that vote for her, to say that these people are living on riverbank and in garbage bin, that they are comrades. The truth of the matter is that most of Jamaica currently living beside a dump because the government is not collecting the garbage. That is the truth. And so for them to come out is as they believe that they are above the law. No, there is a rule of law, none of them. There is nobody in this country that is above the law. And this notion that Dr. Tufton has done well in the Ministry of Health is not true. And I am willing to debate anybody on it. Cornwall Regional Hospital 6 years we're talking about the rehabilitation of Cornwall Regional, and up to now it's still not fixed. And it's not the first time that he's hiding a report. When he had the report from Cornwall Regional, he hid that report for over a year. There were doctors in the hospital, there were nurses, there were other staff members that were getting all sorts of skin condition, respiratory condition, and he did not say anything. Look at what happened during COVID. The only oxygen supply in the country wrote to him for him to increase the oxygen supply in the country. He did not do so, and several persons died over that weekend. We haven't gotten that report yet. Look at what happened with Market Knee and the nepotism. Look at what has happened with the dengue outbreak in 2019. When we were saying to him that yes, it hasn't reached a number yet for you to say there's an outbreak. However, you have increased number of cases. So what you ought to do is to eradicate the breeding sites. He sat and waited for more Jamaicans to become infected, and some died. This Minister of Health has been the worst Minister of Health. He has had the best PR of the Ministers of Health that we've had in the country. But in executing his function, he has been the worst one. And he is very good at running, and I'm appealing to Tufton. Time come for you to run away from the Minister of Health.